So when the Affordable Care Act was passed, did that help in any way solve that problem to a degree?
It was supposed to. So there's federal stuff on like how healthcare is paid for, like with Medicare, and the Affordable Care Act was kind of boosting up people's insurance, but also relied really heavily on expanding Medicaid programs. And certain states like Georgia didn't expand their Medicaid programs almost entirely for political reasons. And that actually had a negative effect because the federal government would pay hospitals with bad payer mixes extra money called disproportionate share payment. So basically, if you're a hospital in rural Georgia and you see a bunch of people who don't have insurance, the federal government will actually pay you to see those people, and you would get money. And then when the Affordable Care Act was passed, suddenly everyone was supposed to have Medicaid, so everyone was supposed to have insurance, which means the federal government said, we're not going to give these extra payments anymore because everyone now has Medicaid. But then states like Georgia would say, no, we're not expanding Medicaid. So now a lot of hospitals in Georgia, like Wellstar in Atlanta, closed because they had a lot of patients. Georgia decided not to expand Medicaid. They aren't getting those extra payments anymore. And then there you go. Now those hospitals can't afford to keep seeing patients. The Affordable Care Act also like put in a bunch of different, not to go into like the specifics of how healthcare is like paid for in the US, but there's a bunch of new models for payments, like value-based care programs, accountable care organizations. There's a whole bunch of like innovation money that they put into, so that that changed things a lot.